name is Emma Barnhard. My ID number is 308501. This is for Veterinary Nursing 2439. That is a good indication for any abnormalities with the heart and lungs. If you hear any wheezing or crackling in the lungs, that could be an indication of an upper or lower respiratory infection. Hearing any abnormal sounds with the heart, any whooshing sounds could lead to you to believe that there might be a murmur, in which case the doctor would come in and listen and then grade that murmur. So now that she's standing, now I'll go ahead and put my stethoscope on. And as I'm listening to the heartbeat to determine the rate, I'm also going to be feeling her femoral pulse. And that'll alert me if there's a skipped beat, if the pulse is too weak or too fast. For every heartbeat I hear, I should also feel a corresponding pulse. And to determine the heart rate, I'll go ahead and count the beats I hear for 15 seconds and then multiply that by 4 for a minute. And now to listen to the lungs, there's 9 quadrants. So I'll go ahead and slowly listen for every breath she takes, and I'll move for each quadrant. And this will alert me to any abnormal sounds in the lungs. Like I said earlier, there could also be pleural effusion or a pneumothorax or pulmonary edema. And I'll move to the other side. And she's not panting, but if some patients pant, you can gently go up, push up on their bottom jaw, and that'll help close their mouth, or you could just hold their mouth closed. Okay. Today I will be demonstrating proper placement and position for an ECG. So we have our patient in right lateral recumbency. And I will go ahead and take my leads and attach them to each head and place my leads. So the black lead goes on the left forelimb. The red lead goes on the left hind limb. And then the white lead goes on the right forelimb. Now if we had a green lead, that would go ahead onto the right back limb, hind limb. And then I'll go ahead and spray some alcohol onto each lead. And that'll help promote conductivity. And then as you can see on here, it's starting to read. I can always cut this out.
Can we
get
maybe
like
let's spray? Might need to like soak it more. It's fine, Belle.
I know.
No, it's alcohol. It's not going to hurt you. You're okay.
And you can see here the P wave, P, Q, R. Okay, so now we can see here the P wave, Q wave, R, and T, and then the QRS complex right here. And that will show us any signs of an abnormal rhythm, and any other heart or...
It will show us any other abnormalities.
this will show us any other abnormalities. And to prevent any respiratory artifacts, you can always go more distal on the limb. So today I will be demonstrating how to use a rabies restraint pole. We use these when we're dealing with very aggressive dogs that cannot be handled. So we have a patient in a kennel right now. I'll go ahead and have my coworker slowly open the kennel door, just enough for me to reach in and get the loop around her head. And then I'll go ahead and tighten. And then when dealing with these dogs on the pole, you want to make sure that they're a good distance away from your body, never facing them head on. And now when to remove the rabies pole, I'll go ahead and use this knob to loosen. Take it out, close the door. So today I'll be demonstrating how to properly clean a kennel or cage. So now that our patient has gone home, I'm going to go ahead and remove that. I'll take the clipboard off just so I can clean the kennel door. And then I'll remove any dirty dishes, towels. And the first step is to get any hair, dirt, debris out first. So I'm going to go ahead and spray with just water. And now the proper order to clean is top, sides, and bottom. The reason for that is anything from the top or the sides is going to fall down to the bottom, and that'll be our last surface that we're going to clean. So we'll go ahead and wipe the top. And now I'm going to go ahead and use some prepared kennel salt. So it's 2 parts solution to an equal 10 parts water. The appropriate contact time is 10 minutes. So after we saturate the kennel sides and bottom with this, we'll go ahead and let it soak for 10 minutes. Go ahead, spray the door. And then we'll wait the 10 minutes. So now that we've waited the appropriate contact time for the solution, I'll go ahead and start with the top, sides, and bottom again. Using a new towel. You can use a sponge as well. Okay, and then I'll wipe off the door. And then I'll go ahead and get this name tag erased and ready for the new patient. So today I will be demonstrating how to perform the Schirmer tear test, and that tests for tear production and overproduction or underproduction. I have my 2 strips here, and so what we'll do is bend this at a 90-degree angle, and I will insert this to the conjunctiva of the eye. And we'll hold that in place for a minute. And as the water or the tear production absorbs onto the strip, we will be able to tell if it's an overproduction or underproduction. If it's 15 or to 30, that's normal. If it's over 30, that's an overproduction of tears, and that could mean that there's irritation in the eye. If it's under 15, that could be dry eye or KCS, and that needs to be brought to the attention of the doctor. We're almost there. And when doing this, you don't want to apply too much pressure to the eye area, but just hold the head gently. Okay, and it's been a minute, so I'll go ahead and gently remove. And as you can see, we're right at the 25 line, so that's normal production. Today I will be demonstrating how to perform a tonometry test. I have my tono pen here, and what I'll first do is calibrate the pen. So you press the button and hold with this pointing down at a vertical angle. And once the DN shows up on the screen, I'll release the button and keep it pointing down. And now it says up, so I immediately face this up. And in the window you can see it says pass. So then we're ready to perform the test. And I'll take the cover slip. Now you want to make sure that it's not too tight, but also not too loose. So I'll use the cardboard and slide that on. Take that off. And then with my coworker helping restrain, I'll go ahead and place a drop of proparacaine in the eye. And then have her pull back on there, and I'll just do 6 soft presses to the eye. And then you can see that the average of those readings come up on the screen. So today I will be demonstrating how to perform a fluorescein dye test. So first I have the proparacaine, which will help numb the eye. I'll apply 1 drop. Now this test is used to see if there's any corneal abrasions or ulcers on the eye. So first I have my strip ready, and what I'll do is I'll apply 1 drop of ophthalmic solution just to get the dye out. I'll take this strip and just gently touch it right to the surface of the eye, just enough for the stain to pick up. I'll make sure the patient blinks a couple times to evenly disperse the stain, and what will happen is if there's any injury, scratch, ulcer to the eye, the stain will pick that up. And next, I'll rinse out the eye. And then, using the ophthalmoscope, you'll be able to look into the eye and see if there's any scratches or abrasions or ulcers on the eye. Today I'm going to be demonstrating how to express anal glands on a dog. First, you have a coworker restraining the dog for you. The anal glands sit just inside the rectum at about 4 and 8 on a clock face, and they can range in size from a pea size to maybe a lima bean size. You just have to see how large they are when you go inside. I have gloves on. I'm going to go ahead and put some lube on my finger. So his are moderately full, and when you are expressing them, you want to make sure not to put too much pressure on the anal gland. You use your thumb and index finger to stabilize the gland, and then you want to do kind of a milking. You want to slowly squeeze it out. And sometimes, depending on the dog's anatomy, you have to move your fingers around where the opening is. inside. And I'm holding some gauze just under to make sure not to make too much of a mess. And you can see normal exudate, it was really easy to express, and I'll wipe off with a chlorhexidine solution. We can also use a groom-mate spray to help with the smell. So today I will be demonstrating how to prepare an enema. So I have some warm water now. What you can use is just plain warm water, plain warm soapy water. And enemas are used in patients that are constipated, and that will help facilitate defecation. I'm going to pour some chlorhexidine solution in there. And then I have a syringe and a red rubber catheter. You can see we have some pee-pee pads on the floor. We can either have her out here with us or place her in a kennel that's properly, that has some proper place, that's properly, yeah, we could place her in a kennel that is properly protected for her. And I'll get this out, ready. And I have a large syringe that I'm going to fill with the solution. So after I have filled my syringe with the enema solution, I will go ahead and lubricate the tip of the red rubber. And then I'll hook up the end of the red rubber to the tube, and then I will go ahead and place it inside her rectum and slowly administer the enema. So today I will be demonstrating how to apply a topical medication on a wound. We have our patient here, and you can see he has some little scabs right on his right shoulder. So the important thing to remember with applying any medication is if you need to clean the area first, if it's kind of bloody or if there's other debris in there, we would use a chlorhexidine solution and rinse off the area, or if you need to shave any hair. For this situation, we don't need to do that. So I have some ointment here, and what we're going to do is just apply, it's okay, come here, can you sit? Can you sit, please? Sit. Good boy. I'm just going to apply a little bit on the area, and you can just rub that in. And then if you need to reapply in a couple hours, sometimes it absorbs pretty quickly. To prevent them from licking it right off, we usually say to take them on a walk for about 10 minutes so the medication can absorb properly. So today I'll be demonstrating how to clean and medicate ears on a dog, and I have our patient here, Louie. I have all my supplies out. With the ear cleaner, you want to make sure that it has a drying agent in it so that if any liquid stays in the ear, it dries out so that there isn't a greater chance of the infection getting worse or coming back. I also have the ointment we're going to use to treat his ear infection, and then I have some cotton balls. So an important thing to remember about the ear anatomy of a dog or cat is that it's shaped like an L. So when you're cleaning, you don't have to worry about going too far in because their eardrum's all the way past that corner. You do want to take into account, though, if the ear is really inflamed or painful, not to clean too aggressively. So go ahead and flip the ear back. I have some cleaner on a cotton ball, and I'll go ahead and squeeze the cleaner inside. Okay. And then mush the ear. And that'll bring the cleaner deeper into the canal, break up any extra debris. Thank you. And then I'll take a dry cotton ball and gently swab out using a J motion. And you can see I got a little stuff out. I'll do just one more. I know. And there we go. And then after that, you can go ahead and apply the ointment. So we'll send home the owner with a smaller version of this, but what I'll go ahead and do is just apply a little bit in the ear, bring it up, and then just rub that in. And that same motion is going to bring down the cleaner into the deeper part of the canal, and his body, he will also bring that down. I will currently be demonstrating how to clean and medicate ears on a cat. So I have our patient here, and I have my supplies already out. We use cotton balls here. You can use gauze squares or Q-tips. The important thing when choosing an ear cleaner is to make sure that it also has a drying agent in it. when cleaning ears, any liquid left behind that doesn't dry out on its own will cause the infection to get worse. It could lead to more bacteria or yeast growing, so that's always an important part. And I'm also going to be using an antibiotic ointment to help treat the infection. So first what we do is take a couple cotton balls and you just pour the liquid on there. And another important thing to remember with the animal's ear canal is shaped like an L, so the eardrum is all the way over here and past that turn, so your fingers are not going to touch it, but you always want to take into account if the ear is super inflamed, be a little gentle with cleaning. So I have the ear cleaner on this cotton ball, and I'm going to go ahead and squeeze some of the cleaner in the canal, and then I'm going to rub. And that's going to break up any debris and kind of get that cleaner down into the distal part of the canal. And then I'm going to go back in with another cotton ball and use kind of a J motion. And then you can see I have some gunk on there. So after doing that a couple of times, then we're going to want to medicate the ear. And with this, when we send home with clients, is a smaller bottle, but this is what we have in-house. I'm just going to go ahead and place a small amount in the ear, and then he'll shake, and then just mush it in. His body heat will bring that down into the distal part of the canal, and then this medication we use twice a day for 14 days. So today I will be demonstrating how to administer subcutaneous fluids. I have a fluid back here with a fresh needle. The needle size you'd want to use is an 18 gauge or a 20 gauge. You want a larger needle to make sure the fluid can flow easily. So I have the fluid line blocked off right now. And what you want to do is tend the skin so you can get a nice area to puncture. So I'm going to go ahead and take the cap off and make sure bevel is facing up. Just insert that. And now I can go ahead and push, and you can see the fluid is flowing really nicely in that little window there, and then we can do the desired amount needed. Trim nails on a dog. I have a coworker restraining the dog for me, but first I just want to go over a couple of the supplies. I have a Dremel here, which is a motorized file that we can use sometimes. I also have a nail clipper, and then I have Quick Stop as well. When we use Quick Stop is when we hit the quick of the nail, which I can show you is the pink part where the nerve endings and blood vessels are, and that'll go ahead and stop the bleeding. So I'll go ahead and get into position. And you can see, come a little closer. You can see that his nails aren't too long, but you can see right where the white part is, that's what we're going to try to trim off. So I'm going to go ahead and use the Dremel. You can file and get a nice rounded edge. Good boy. And that's it. Today I'm going to be demonstrating how to trim nails on a cat. So I have my supplies out, a nail clipper and then some Quick Stop just in case you do accidentally hit the quick. You can put the Quick Stop or styptic powder on and that'll stop the bleeding. The one thing with cats is their nails actually retract. So in order to expose them, you have to press on the paw pad and then simultaneously pull the skin back. So I'll go ahead and have my coworker put him on his side. And then you can see I'm going ahead and pressing, and there's his nail, and you can see the pink and then white part. I'm going to go ahead and just clip. The next one, clip. That. Today I'll be demonstrating how to apply an abdominal pressure bandage. This is used if we're concerned about any hemorrhaging or any drainage from an incision site. So the first layer we're going to do is a highly absorbable Telfa pad. And this will be our first layer of absorbing any exudate from the area. Go ahead and apply pressure there. And then I will follow up with cast padding, and that'll also absorb any extra exudate from the area. Same principles apply. You want to make sure it's not creased or too tight. Since this is a temporary bandage, even since it's a temporary bandage, we want to make sure it's still not too constrictive since it is on her abdomen. I'll follow up with vet wrap. And after we are finished with applying the bandage, we'll monitor her closely and make sure that none of that the exudate isn't leaking through the bandage. It's not too tight, it hasn't moved. If you are doing this on a male dog, you do want to be aware of the prepuce. If this isn't an emergency situation, you can definitely cover it, but be aware that if they need to urinate, that could affect, the bandage could affect that. Since it's temporary, we wouldn't necessarily use Elasticon. If we were doing a bandage we were going to keep on for longer, we would apply Elasticon to each side to prevent any slipping. And to remove one, I'll go ahead and take bandage scissors. Just cut through, come off. So today I will be demonstrating how to apply a modified Robert Jones bandage and a splint. I have all of my supplies here. If we were dealing with a wound or a laceration, we could use a Telfa pad, but since we're going to be doing a splint, we won't be using that. Now, this is the correct splint size for her. This would be a good splint if there's a fracture in the metatarsal area. So first what we're going to do is get our stirrups. You want to make sure they're long enough that you'll be able to twist and place them back on here to provide some extra support so the bandage does not slip. So we'll first do is apply the adhesive side to each side of the leg. I'll go ahead and take my cast padding now, and you want to make sure that you roll opposite so it's not too tight, and that as you're rolling it, 50% is overlapping and there's no creases. I'll go ahead up to her wrist, and then I'll come back down. And since we will be doing a splint, I'll go ahead and go over her toes. And now I'll go ahead and place my splint. If I wasn't using a splint, I would then apply a layer of stretch gauze and vet wrap, but at this point we're going to be placing the splint. And this extra layer of cast padding will just provide extra support for when she's in the splint. will go ahead and apply the stretch gauze layer. This is a pretty bulky bandage, but with the splint we want to make sure that we have another layer of cast padding over that to provide extra support. So I'll do a thin layer of the stretch gauze. And the same method applies. We want to make sure there's 50% overlap. It's a short piece. It's important to not apply too much pressure. You don't want it to be too tight. And now I will go ahead and attach my stirrups. You just twist so that the adhesive side is applied to the stretch gauze and cast padding. Okay, and then now I'll take my vet wrap. It's important to loosen the vet wrap first so that you're not compressing the bandage too tightly. And this is just an outer protective layer. Go ahead, start. And then the last step is to apply some elasticon to the top and then just a little strip here to prevent any damage of the cast or splint bandage. And this just adds some extra support to help the bandage from not moving or slipping. So now that we have the bandage and splint applied, I'm going to go ahead and make sure that the owner gets sent home with a bag or protective layer to put over the bandage. It's definitely important to keep the bandage clean and dry during the time the bandage is on the patient. Now I will be demonstrating how to remove a bandage and splint. So first we just start removing the elasticon. And if there's a wound or a laceration, we definitely want to be aware of where it is on the leg. Using bandage scissors with the blunt tip, I'm going to go ahead and just start cutting away. Now if it's a really thick bandage like this one, you might have to cut in layers. Layer off, and then go ahead and start unwrapping and take the splint off. You can unwrap or you can cut as well. So today I will be demonstrating how to administer medication in a pill form for a dog. I have a couple of things out. Thank you. You can either do it just with your hands or you can use a pill popper. If the patient's being pretty uncooperative, I think a pill popper is the better idea, and you can have another coworker restraining. He's really good, so I can just do it myself. In replacement of an actual medication, I'm just going to use a little piece of kibble. So what you can do is just pry their mouth open with your index and thumb, and then place the medication at the back of their throat, holding their mouth closed and then rubbing their throat to get them to swallow. You can also blow on their nose, and that gets them to swallow. Okay, good boy. And then after that, you want to administer just a little bit of water. You can offer them a bowl of water, or I have a curved tip syringe with some water just to ensure that the pill is not going to get stuck in the middle of their throat and cause any irritation. There we go. Okay. All right. And that's it. So today I'll be demonstrating how to administer a pill to a cat. She actually is due for her methimazole dose, so I'll go ahead and do that today. There are a couple different ways you can do this. You can either use what we have as a pill popper, or if the patient's good and they'll let you, you can pry their mouth open and just stick the pill at the back of their throat. If the patient is pretty wiggly and not being very cooperative, you can have another coworker restrain them, but she's pretty good, so I can just do it myself. So what I'll go ahead and do is use my thumb and index finger and lift her head up, put just gentle pressure on her cheeks, and then I'll go ahead and place the pill at the back of her throat. And while holding her mouth closed, you can either breathe on their nose or rub their throat, which gets them to swallow. Okay, and then to ensure that the pill isn't going to just sit in her throat and cause any irritation, I have just a little curved tip syringe with water. And I'm just going to go ahead and kind of do the same thing and just give her a little bit of water. And that'll help move the pill along. Today I'll be demonstrating how to take dental x-rays on a patient during a dental procedure. So we have our anesthetized patient here. I have the program we're going to be using on the laptop. I have the probe hooked up with some vet wrap to protect it from the teeth. I am going to go ahead and set the settings for the premolars. We're going to be doing the upper right, the 100s. So here, I'm going to position the probe, making sure the right side is facing the teeth. And as you can see, my coworker and I are both wearing personal protective gear gowns and our dosimetry badges. So I'll have that set. We have looped her eyes as well. And I'll go ahead and take my x-ray head and position it at an angle. Being careful not to hit her or injure her eye. Okay. And now I'm going to go ahead and take a slight step back. Oh, and first, an important thing to remember is to select the teeth we're going to be x-raying. So we're going to be doing the premolars of the upper right quadrant, so 100s. I'm going to go ahead and select these guys. And once it's flashing, it'll be ready for me to take the picture. Make sure that's positioned nicely. So here on the picture you can see I have the canine the premolar and another premolar. You can see the pulp in the middle, the surrounding gingiva, that line. I don't see any pocketing. You would see some darkness around the roots. So there's that one. Now I'm going to go ahead and x-ray the upper canines and the incisors. So I'll change my settings on here. On here as well, I'm gonna select the incisors and I'll see how the picture looks. I'll go ahead and move my probe. Now sometimes to get the right angle you do have to manipulate the head. So I'm going to hold the head up slightly. So I've just missed the root of this canine, but you can see this canine here and the incisors. So today I'm going to be demonstrating how to hand scale during a dental procedure. I have my sickle scaler here, and you can see the difference between the supragingival and subgingival instruments is there's this nice point on the supragingival, and this one has a more rounded edge to get underneath the gingiva without traumatizing the tissue too much. So I'm going to be using a, not a modified pen grasp, but just a pen grasp, and I'm going to support her head and take the cutting edge. I'm going to hand scale from the gingival line to the crown. And while you're doing this, you can feel the surface of the tooth, any ridges, uneven areas. And there are a lot of different instruments. Some are more catered to different teeth in the mouth. I believe this one's a universal scaler. There are some that are specific for molars, canines, and incisors. And now, and you can see all that calculus I got off of the surface of the tooth. Now I'm going to take the subgingival curette and I'm going to gently go under. Now there's not much space, which is good. And then after I'm finished hand scaling, I'll go ahead and use the Prophy paste and polish the tooth. Today I'm going to be demonstrating how to scale teeth during a dental procedure with an ultrasonic scaler. So I have here, I'm going to wrap the cord around my arm. That prevents any tension on the cord from pulling while you're scaling, gives you more control. I'm going to be using a pen hold on this, but first I'm going to take my probe. I'm going to take my probe and probe along the gum line, checking for any pockets. And as you can see, there's really can't go far in there, which is good. This tooth here, you can see is resorbing. So now, I'm first going to use some chlorhexidine solution to decrease the chance of bacteria, aerosolized bacteria from getting to me or her. So I'm going to squeeze some chlorhexidine in there. Now, I'm going to put on some protective goggles. I already have my gloves and face mask on. So now, I'm going to take this, and it's also hooked up to the water. I take this, and now with the ultrasonic cleaners, you want to go from the crown of the tooth to the gum line, the opposite way when you're hand scaling. And you never want to scale at a 90-degree angle right on the tooth. That can definitely damage the enamel of the tooth, creating more ridges or deficits on the surface of the tooth. And you do not want to scale for more than just a couple seconds in each spot. So I'm going to be kind of taking little breaks just to prevent any extra damage. You can see I'm at an angle and there's water coming out. You can see that tartar. And now actually you can see that once I got the tartar off, there's actually this defect in the tooth, a little bit of a pocket. So I'm gonna go ahead and x-ray that tooth. Today I will be demonstrating how to polish the teeth after you're done scaling. So first I'm going to apply some extra eyelid. She already has some in, but I'm just going to put some more in to protect her eyes. And you can see my coworker and I both have protective eyewear on. I still have my mask on and my gloves. I'm going to go ahead and take the head of the polisher, attach that on there. I'm going to wrap this around my arm as well to relieve any tension while I'm polishing. So you want to get enough polish in your instrument to cover the tooth. The important thing about polishing is not to apply too much pressure. You want it to flare out slightly, and you want to polish for no more than 3 seconds at a time. You want to do each side of the tooth. And then after we're done polishing the entire mouth, I'll go ahead and rinse out with some water and extra chlorhexidine to get rid of any extra prophy paste left behind. So today I'll be demonstrating how to discuss at-home dental care with a client. What we first talk about is how to brush teeth. So if you're new at brushing teeth at home, you can start with a gauze sponge just wrapped around your finger and using a chlorhexidine-based dental rinse made for dogs. You can squeeze them on your finger, and without prying their mouth open, you can just lift up their lip and gently rub. And what we always say is to just feel. So you can feel at the gum line, rub there. You don't have to get inside of the teeth. You can move around to the other side. It's a lot easier than just trying to pry their mouth open.
Yeah, that's easier. How often should I brush?
So ideally, we say that you should brush their teeth twice a day like we do. As long as you do it at least a couple times a week, once a day is ideal. Once you and your pet get comfortable with the gauze sponge, you can work your way up to a baby toothbrush, soft bristle toothbrush, even veterinary toothpaste. You cannot use human toothpaste because of the ingredients in there are not good for them.
Okay.
Other things you can do is use some treats, like we have OraVet chews. There's dental hygiene chews. There's veterinary diets that are specifically made for dental issues. Purina has DH, Hills has TD. There's also greenies that can help with the tartar buildup, but we always say brushing is #1 priority to prevent dental disease.
Okay, and what about bones? Would those help clean your teeth?
So we don't recommend antlers or pig ears. If they chew too vigorously, it can damage their teeth or break their teeth.
Oh.
And if they get a big piece off and swallow it, that can be a foreign body and injure their throat or other organs.
Okay, well I think I'll take some dental rinse then.
Okay.
Start that.